Hello, my name is Steve Gersner. I'm the Program Director of the Billings Clinic Internal Medicine Residency. It's my pleasure to be able to introduce this glimpse into what we're all about. Billings Clinic is an academic medical center that provides tertiary care to a wide area of our region, and that includes a large part of Montana, Wyoming, and North and South Dakota. Medical education has been a pillar of our mission, starting back in 1974 when we began a relationship with the University of Washington School of Medicine, during which time we've been providing teaching for their medical students. Our internal medicine residency began in 2012 when we began the process of developing the program, and in 2014 we started our very first class. During this time, Billings Clinic has transformed into this learning environment that incorporates learners of all types, and the medical residency is the cap of all of that. The mission of our residency is to train interns to be capable of providing care to the medically complex people in a rural environment. Our program places emphasis on ambulatory care, but also has a strong presence in the inpatient wards as well as the intensive care unit. Our residents also rotate to 2 rural sites, and that gives them a feel of what it's like to practice in an area of more scarce resources. Our residents will be well equipped to practice in both the ambulatory setting as well as hospital setting, and even go on to fellowships, of which we have a 100% pass rate. What makes our program really special is our group of residents and faculty. We are really a very intimate group that rely on each other for support. Our leadership resides right within our own clinic setting and are readily available to our residents. But what I'm most proud of is how we all come together as we overcome challenges that certainly have occurred over the past year. I appreciate your interest in our Billings Clinic Internal Medicine Residency. I've shared much about our program, but there's much more to be said. I'm going to allow our residents to tell you more.
So I interviewed mostly at places in the East Coast. This was the farthest that I came from home in South Carolina, and it was by far my favorite. I just loved the environment here. I loved all the people here, and I appreciated the rural aspect of the program. I was actually looking for a more rural type of experience, and the fact that we have such a balanced learning experience between inpatient and outpatient was the kind of program that I was looking for. At Billings Clinic, we have a true curriculum for outpatient medicine. We have a clinic that has support staff that we get to know really well. We work closely with them. We have a true patient panel that kind of keeps growing, and we accompany those patients. We get to know them really well. We see them when they come into the hospital. So I think it's just a really robust program for that.
I think it's valuable to come to this program even if you're not staying here, really because of the people. Everyone here has been so amazing and just wonderful to work with. Everyone's very passionate about teaching. I think really no matter what you go into, this program is wonderful. You have a lot of opportunities to work with the different specialties, and it's been a great experience.
Here at Billings Clinic, we get excellent training in critical care medicine as part of the internal medicine residency program. I think it's really one of the strengths of the program. One of the good things about training here at Billings Clinic is that we don't have a fellowship program here for critical care, and so you're not competing with critical care fellows to perform procedures and things like that. So we really get excellent procedural training as part of our critical care experience here. You will get very proficient at putting central lines in, trialysis catheters, arterial lines. If you're interested in doing intubations, that is definitely something that you'll get a lot of experience in if you show an interest in that area. All the attendings in the ICU are excellent teachers, and they spend a lot of time teaching, and we'll have our own kind of didactic sessions during the ICU experience.
The reason I chose Billings Clinic residency is because actually so many reasons. One of them include that I'm interested in rural medicine. I grew up in Tanzania, born and raised, and I grew up in the rural region, and I felt like I needed this experience. So another reason I came to Billings Clinic is because the program is small, and I wanted to be in a small program where you get to see a lot of complex patients, including those with end-stage liver disease, end-stage renal disease on dialysis, and those with heart failure and other coronary diseases. And faculty to resident ratio is very small, and I think that's one of the the reasons that differentiate this program from other programs.
The interview this year was weird. It was on Zoom, so it was all virtual. and I just felt like the interview went fantastic. So Dr. Gershner is just one of those people that you can tell how much he loves medicine, even on a computer screen. That stood out to me because it was very different than other programs I interviewed at. The whole interview process went fantastic. And then I was thinking maybe I was swayed because it was on Zoom. I never was able to come here in person. And so I called the chief resident, and she was fantastic and answered all the questions. She reassured me that it really was what I was looking for. So size of the program was important. So wanted something not terribly small, but also not too big to where you're kind of lost in the group. So a strong mentorship program was really important to me. They have that here, and it has played out already in the first couple months. And other things I was looking for was just the ability to really, get specific mentorship when it comes to what you want to do career-wise. So is it more inpatient or outpatient or a mix of both? They also do that here. The reputation of the program is also something unlike what I've seen before. So if you go to the grocery store here and you tell someone you work at Billings Clinic, the first thing that they say is just, that's so amazing, I love Billings Clinic. They're an instant fan, an instant fast friend. That's unique to this community. You don't see that everywhere. Sometimes, you get the sideways like, oh, you work there, but no, here everyone loves Billings Clinic.
I came to Billings Clinic for a lot of reasons. I felt like people knew each other. I felt like people really got to sit across from their co-residents every day and knew most things about them. There was never stories of people going their entire 3 years without getting to know a lot of their classmates.
So something that drew me to Billings Clinic was definitely the rural aspect. I come from a small town in Iowa, and it's something I always want to keep a focus in my future career. A question I had coming here was, being a community program, what sort of scholarly activities were even available? And so I've been greatly surprised. One opportunity we have every year is that all the categorical interns will present a presentation on a project of their choosing focused on rural medicine. All residents will have the opportunity to present at ACP and the Primary Care Symposium, and then some even have the opportunity for national conferences, including CHEST and ATS. If you express any area of interest, all of our faculty is wonderful about helping you in any way, and that's including finding research opportunities.
Well, one of the reasons I came out to Billings Clinic for my residency is I actually had the opportunity to work here as a sub-I in my 4th year of medical school. And just looking through the network as a sub-I and then interacting with the residents at that time and the faculty, it just felt like a place where I could call home. We do have an opportunity to do 2 rural rotations during our residency program. One's usually set up for 2nd year, and then the other one is during our 3rd year. And our 2 sites currently are Lewistown, Montana, and then Sheridan, Wyoming. One of the nice things about going down to the Sheridan Hospital is that we get a lot more autonomy, and we do work one-on-one directly with an attending physician. And one of the nice things there, we get to work in the local hospital there, and then also spend 1 week in the clinic. And one of the things that I appreciated from that experience is learning what resources those smaller hospitals have. And it really gives us the education on knowing when to transfer patients to higher levels of care, and knowing what we can manage locally with the resources that we have versus needing to transfer those patients out to a more acute facility.
I am originally from Norway. I came out to Montana because I was very interested in the Western ranching and horseback riding culture, and I ended up loving it so much out here that I have now relocated my life to rural Montana. So my goal as a physician is to work in these rural areas of Montana, either as a primary care provider or as a hospitalist. And Billings Clinic, this program is perfect for me because it has a strong outpatient curriculum as well as inpatient curriculum. So I feel like I will have the tools that I need to be a physician in rural Montana.
One of my favorite things about being in Montana outside of residency is all the sunshine. I love sunshine. I love clear blue skies, and Montana has plenty of that. I love it.
I look forward to snowmobiling this coming winter.
I would say that Billings is a place with a pretty lively cultural scene. Certainly before the time of COVID, we had a lot of live music opportunities, quite a few local music venues that were near downtown. Also used to do downtown events where they would bring music in and close down the streets and bring in vendors and things like that. I also really enjoy the food and the brewery scene here. Billings is a big enough city to have a lot of the different varieties of of culinary cuisines, but it's also small enough that you're never waiting in line for a table, and you can kind of easily go out and get a meal with family and friends without having to plan too far ahead.
The thing that I've enjoyed the most since moving here is definitely the outdoors. I was sort of a fake it till you make it as far as hiking goes, but I've always really enjoyed living near the mountains, and I love skiing and snowboarding, so I would say definitely the outdoors is the biggest draw since I've moved here.
When I get free time, I really enjoy outdoors activities, and so I enjoy skiing in the winter time. I like to go hiking in the summertime and fishing. Just last weekend I was actually up at West Rosebud and I caught a little brown trout. So being able to just get out and enjoy the outdoors is a great opportunity living in Montana.